Here we are on day 1 through our journey of sickle cell, 30 videos in 30 days in honor of June 19th, World Sickle Cell Day. So let's start where all your blood starts, in your bone marrow. Your bone marrow is often talked about in relationship with bone marrow transplants for cancer patients, but what exactly does bone marrow have to do with sickle cell disease? Well, bone marrow is a squishy, jelly-like substance found deep inside the middle of your bones. Yes, you're hearing me correctly. The middle of your bones are actually soft. So your bone marrow acts like a factory, and all day, every day, it's pumping out blood cells. Platelets, white blood cells, red blood cells. But the ones we're most concerned with sickle cell are the red blood cells, which carry oxygen. In a healthy person, the red blood cells live for about 4 months. However, a person living with sickle cell is lucky if their blood cells live for approximately 20 days. So how does this all affect the bone marrow? Well, because your sickle cells can't live as long, your bone marrow has to work approximately 6 times harder to produce new blood cells. So what this leads to is a body that never really has all the blood cells it needs. Many people think of anemia as a lack of iron, but actually in sickle cell disease, this anemia is related to the inability for your bone marrow to keep up with the production you need for all your red blood cells because they're dying too fast in conjunction with how fast that factory has to work. We also see that people with sickle cell disease have to eat about 25% more calories because their bone marrow is working on overtime all the time to create those new baby red blood cells called reticulocytes. Stay tuned tomorrow when we talk about what exactly those 3 blood cells that are created are and what they do. Check us out on the web at hopeforstd.org. Post your comments or questions down below and stay tuned.